Hello, my name is Emily Wan, and this is Sam Cummins. We are the substance abuse prevention team here at Hoyleton. Today we'll be talking about substance use disorder. We hope that this presentation will help answer some of your questions that you may have.
So my name is Sam Cummins, and I want you to think about what is substance use disorder. Substance use disorders occur when there is a recurrent use of alcohol and/or drugs. It can cause clinically significant impairment, including health problems, disability, and failure to meet responsibilities like work, school, or home.
Now that we understand what the definition of a substance use disorder is, I'll focus on determining how we can identify someone if they have a substance use disorder. Here I have substance abuse versus substance use. We see here that substance abuse involves using a substance like a drug or alcohol compulsively. For example, someone that is abusing substance would use the substance in a large amount 5 days a week and have an inability to stop the use. On the other hand, we have substance use. Involves someone using a substance occasionally and responsibly. For example, this person would drink about 1 beer during special occasions or holidays.
So the next thing I want you to think about are the types of substances. Some examples are alcohol, vape pens, or e-cigarettes, cigarettes, marijuana, also known as cannabis, and then there are opioids. Also, I want you to think about the signs of substance use disorder. Some symptoms can be a typical teenager, but you know your child and will notice changes. Some signs include physical signs, which can be bloodshot eyes, sudden weight loss or weight gain, interrupted sleep patterns or a change in complexion, poor hygiene, tremors, slurred speech, or impaired coordination, unusual odors on breath, body, or clothing. Some psychological symptoms include depression and anxiety, low self-esteem, poor motivation, and irritability, and mood swings, sudden change in personality or attitude. Changes in behavior can be a sign, which can include secretive behavior, ignoring responsibilities, financial distress, sudden change in friends, favorite hangouts, hobbies, withdrawal symptoms such as nausea, restlessness, insomnia, depression, sweating, shaking, and anxiety. Changes in performance, missing school or work, poor decision making, increased conflict, and theft because they need to make money for their addiction. The National Survey on Drug Use and Health studied if adolescents drink alcohol occasionally, binge drink alcohol, and/or admitted to an alcohol problem. In 2019, 2.3 million children ages 12 to 17 said they drank alcohol in the past month. Also, 1.2 million said they drink alcohol or they binge drink alcohol, and 14.5 million said that they have a problem with alcohol. Excessive use of alcohol can lead to an increased risk of stroke, liver cirrhosis, alcoholic hepatitis, cancer, and other serious health conditions. The National Youth Tobacco Survey wanted to know how many youth use the product. To help you understand a bit more, e-cigarettes are vape pens, e-pens, Juuls, and vaporizers. In 2017, 11.7% said that they use an e-cigarette. In 2018, 20.8% said that they used a e-cigarette. The number of children using e-cigarettes is rising. Think about why is that? The flavor of an e-cigarette is enticing and appealing compared to a regular cigarette. 68% of teens prefer flavored e-cigarettes over other types.
As for the St. Clair County, these are data published in 2020 taken from a statewide survey. We can see here that in 2017, 18% of the adults in St. Clair County area smoked. When we compare the number to the state of Illinois, It is about 15% of the population. We see that there is a higher concentration in St. Clair County of adult smokers. In 2017, we can see that 20% of the adult population report heavy or binge drinking. Compare that to the state of Illinois, it is very close to 21%. In 2016 to 2018, about 182 people out of 100,000 people died from drug poisoning in the St. Clair County. Compare that to the state of Illinois, we can see that it is a lower number, meaning that 21 people lost their life out of every 100,000. We can see that there is a higher concentration in the St. Clair County for drug poisoning. These data are concerning because these problems are more concentrated in this community. Here, we are going to focus on the youth substance use. In St. Clair County, 31% uses marijuana. This number has increased since 2010 when it was about 25%. So we can see that the use of marijuana has increased. As for the alcohol and smoking, our teens in St. Clair County count shows that the uses have decreased. This could be due to the knowledge and prevention work that has been done in the past 10 years. Although this is good to see, we hope that our community continues to decrease our teens' use in all substances.
It's important that we talk to our children about substances, and here are some examples how to. We need to talk to them in a non-judgmental way because we want them to feel safe. We have to show we are paying attention to them. We need to set clear rules about substances, such as an age limit. We need to explain how illegal substances are in an age-wise or federally illegal, are dangerous for their young brain and body. We need to explain the reason for an age limit on substance use, such as vapes, alcohol, and marijuana. Another guide is to stay engaged in your child's life. Create a safe word with your child, especially if they're at a party, so your teen can ask to come home without causing alarm. Set expectations with your child. Let them know that you want, such as you want them to not consume alcohol until the age of 21 or not at all in the home. Help your child practice healthy coping skills, especially if they're stressed or there are social pressures. Examples that include to help with stress are yoga, journaling, music, exercise, drawing, or other healthy outlets. We need to be informed of our current trends on drug use and alcohol use.
So based on our research, here are some local places that have Spanish-speaking aides. If you suspect that your teen or loved one shows signs of substance use disorder, they can get evaluated and put into proper care or treatment plans. Also, please notice that on the bottom, there is a universal number that you can call at 1-800-662-4357, and they will have a Spanish option to help find help. Here are some online resources. At Hoyleton, we have many resources that we can help your family if you experience a substance abuse issue. Please know that it is always better to get help sooner than later.
These are our references for the information provided today. I hope this information we talked about today was helpful, and if you have any questions, please ask. Thank you.